First of all, let me introduce myself. I'm Professor UV Kiran. I'm from India, working in a central university, Babasaheb Bhimrao Ambedkar University, which is in the central part of India, towards the northern side. That is Lucknow, Uttar Pradesh. The state is Uttar Pradesh. So I'll be speaking about the exposure to paints and respiratory health ailments among painting workers. We all know there are various occupational health issues which exist in among various workers who especially work in the unorganized sector. If you see the specific statistics, we can see the statistical data which speaks that workers in unorganized sector suffers various occupational health issues. And since the sector is unorganized, the work on them though is meager and it is reported well, but the assessment and the safety health issues which has to be taken up by them are very less. So I specifically try to work on the workers working in the unorganized sector, like construction workers, sanitary workers, painting workers and all. And I try to assess the occupational health issues, and in our research lab, we try to develop some kits and we try to create awareness among the workers so that they can at least use some safety instruments and can overcome some occupational health issues. So if I say about overview of my presentation, I'll be speaking I'll be orienting the audience about what are paints, what are the various components of paints, what are the various types of paints usually in general people use, especially in India under Indian circumstances. And then I'll be little bit dealing about the statistical data, and then I'll be moving on and I'll be telling a little bit about, especially in this presentation, I'll only be dealing about the respiratory health ailments on the workers which we have studied, and what are all the various parameters which are having an impact of increasing respiratory health ailments among especially the painting workers. So if I speak about what are paints, hope I'm audible. I can't see anybody actually.
Yes, you are audible. Go on.
Thank you. What is a paint? Paint is a dispersion of finely divided pigments in a liquid composed of resins, binders, volatile solvents, and of course we generally use it for on the metals, wood, gypsum, or plaster. So they include paints, varnishes, lacquers, stains, printing inks, and you name it. You have many on which we generally do the paint. So when we speak about the traditional paints, they especially contains a dispersion of pigment particles. It consists of a binder, a thinner, and in addition, we have certain additives in it. So when we speak about the film former or binder, it is usually an oil or resin. And if we speak about a thinner, it is usually a volatile solvent. And of course, it has some additional additives, which is a composition, which makes the composition of paints. So paints or varnish or stain products, they contain thousands of chemical components which the painting workers get exposed to, and due to which there are many respiratory health ailments which comes up in the painting workers, which do have pigments, extenders, binders, solvents, and other additives. When we speak about components of paints, there are basically 5 components of paints. Paint has a base, it has a pigment, it has a binder, it has a liquidative agent, and it has additives. So when we speak about what exactly is the base, so base is a solid substance which forms the body. Body of paint is made from the base. It forms the bulk, and it usually consists of lead, red lead, zinc oxide, iron oxide, titanium white, aluminium powder, lithopone. You see, all these components which I am speaking about are quite dangerous. They may lead to many, there are many carcinogenic substances in it. And of course, when they're inhaled directly by the painting workers, it may lead to many health ailments, ranging from illnesses of smaller illnesses like cough to cancer. The other component of the paint is called as pigment. It the color and appearance of the paint is denoted by the pigment. Some pigments provides bulk so that it will thicken the paint. So usually the components which we have in pigments are carbon, earth clay, ultramarine, etc. These are the usual pigments used in the paints. When we speak about the binder is responsible for providing the adhesion, and also it also provides the resistance properties so that the final coating will be durable and it is tough. So basically, there are two kinds of binders which generally are used, oil-based binder and latex-based. There is one more, the other component is paint thinner or liquid. It reduces the viscosity of the paint so that it can be smoothened, so that applicability will be easy, and it also helps in absorption and adsorption towards the porous surface for the smooth appearance. So oil-based paints use liquid like alcohol as a solvent, and the thinner most commonly used is turpentine. Additives, when you have to manipulate certain properties of the paints, the basic paints, along with all the other four components, thickeners usually are used, or some chromatic substances are used, so that it will be giving an additional property to the paints. So in general, there are five types of paints which are generally available in the market. One is solvent-borne paints, water-borne paints, high solid paints, powder coatings, and radiation curable coatings. And if we speak about the Indian circumstances, majorly solvent-borne paints and water-borne paints are used at a maximum count, and then in some followed by high solid paints and powder coatings. Since radiation curable coatings are very costly, they are very less used. What are solvent-borne paints? Solvent-borne paints has the oil as the base, and it has hydrocarbon solvents, and along with the binders, pigments, and additives. It has a liquefying agent as the main component, and since liquefying agent is the main component, with a combination of hydrocarbon solvents, they are called as oil-based paints. So once the liquefying agents get into touch with the oxygen, combines with the oxygen, they get evaporated. Then water-borne paints are water-soluble binders. It contains low molecular weight polymeric binders dispersed in water, and it forms true solution. They're non-toxic, non-combustible, but they're characterized by long drying time and due to slow evaporation rate of them. Then you have high solid paints. They are paints containing 65% of solid components mixed with the solvent serving as a vehicle. Since solvent content is very low, viscosity is very much higher, 3 to 4 times higher than in the conventional paints. And they also get reduced due to the chemical modification or heating the paint before application at 104 to 150 degree Fahrenheit. Whereas the powder coating paints contain 100% solid components with binders, pigments, and additives in form of finely atomized powders. They contain no solvent. They're obtained from powdered resin particles. They work based on the electrostatic force to the substrate surface, and of course there is no solvent involved in the process. So these powder coatings have produced no waste or very less toxic waste. As I have already told you, radiation curable coatings, their cost is very high, though they do not produce any toxic waste. So when we speak about, this was just an introduction for the paints, so that we'll get an idea what exactly are the paints available in the market. So basically, our lab has conducted a study on what are all the various health hazards which which are exposed by the painting workers when they're doing their work. And it was also very interestingly known that moreover, more than the chemical components in the paints, the painters are being exposed to the dust particles, the finer dust, while they are working. Since they are not using proper safety gear and all, they're getting exposed to those finer dust, and hence they are being prone to all kinds of respiratory illnesses. So in general, when we speak about the health hazards, there are 4 problems which the painting workers face. Of course, exposure to toxic vapor, dust inhalation, and if we speak about the musculoskeletal disorders, which the painters are involved because of the improper posture they adopt while doing work. They have to climb, they have to adopt many awkward postures, and due to which they have many problems related to back and neck and the upper arm disorders, and of course they're prone to accidents. So if we speak about the toxic vapors or the dust, major problems faced by the painters are skin sensitivity, excessive urination, gastrointestinal issues, and increased albumin excretion in the urine. When we have a look at the statistical data, in the year 2020 Occupational Safety and Health Report says that paint and pigment industries are one of the industries which are responsible for health and environmental hazards, since due to the dangerous chemical composition which the paints have. And according to National Sample Survey Office, which was conducted in 2011 and 12, when we speak about the overall workforce working in the unorganized sector, there are around 47.41 crore, whereas 11.5 crore people work in industries and 23.1 crore people work in the unorganized sectors. One more survey conducted by international community by World Health Organization and United States Nations Environment Program, it says that they want to exclude the lead-based paint by 2020 because of the significant health concerns to the people who are working in that industry specifically. And it was seen that lead contents in paints surpass 10,000 mg per kg in India, along with many other Southeast Asian, African, Latin American, and European nations in a study conducted by O'Connor et al. In 2018. So the present study was conducted to investigate the impact of paints on respiratory health of the painters. It was one of the objectives of the total research conducted on the painting workers. So we have also seen the musculoskeletal disorders which are being faced by the paint health workers, and on the other side we have also compared the painters with the non-painters and at what age they are having the significant health concerns related especially with the paints and the we have also tested the chemical composition of the paints, and we have seen what are all the components available at what levels they were present in the paints. So especially we have tested for the heavy metals and along with the lead. So for the present presentation, I'm also only dealing with the impact of paints on respiratory health of the painters. So we have conducted a study taking 150 sample in 3 different regions. We have also assessed the socioeconomic status of them, and of course we have seen the respiratory and lung problems, especially based on 9 items: shortness of breath, breathlessness, cough, phlegm and blood, chest problems, irritation with pain, etc. So it was analyzed using SPSS. So when we see the data, the general information, we can see that majority of the respondents of our sample belong to 47 to 60 years, 45%, followed by 39% in the age group of 33 to 46 years. And of course, we can say that it may be due to the active age group, which generally gets involved in the work. And the majority of the respondents have only education till primary, followed by high school, and most of them are illiterate, 21%, and many of them do not have higher education, any education after the junior or high school. And this also may be the reason why training them, creating awareness among them regarding the safety gear, for some time they will use, and after some time they will not use, they will not get it into a regular practice, so due to which they are being exposed to many health problems while they are working. So when we have assessed the socioeconomic status, it is very obvious that people majorly belong to the lower economic status, followed by upper lower economic status and the lower middle economic status. occupational profile of the painters, we have taken people, we wanted to see whether the years of working experience has any impact on the respiratory health ailments which they are having. And we also wanted to see whether age has a significant factor, because when the age increases, automatically many of the respiratory health ailments also increases. We also tried to link it up with it. So we in our sample, which was randomly collected, we have people of all work experiences, starting from below 5 years to more than 15 years of work experience, and majority of them were 30.7% belong to having more than 15 years of work experience. So they work, majority of all 7 days, and majority of them work for 7 to 9 hours per day, which is a huge time. When we see, have a look at the results, when we have seen how these lung problems have any impact due to years of working of the respondents, we can see that people having more exposure, or means people who were continuously working for more than 15 years, they are prone to have more health problems, followed by 10 to 15 years, onto the lower side 5 to 10 years, and these 0 to 5 years people. So when we also link it up with the age, of course, the people who are having 0 to 5 years of experience or of lesser ages, but yes, we had respondents who were having less experience, but still they have more lung problems. So here we had ruled out the do the age has any contradictory impact on the respiratory health ailments. So we can see all the age has a significant, the work experience has a significant impact on the lung problems. In all the cases, whether it is shortness of breath, cough, phlegm and blood, chest sound, wheezy and whistling, tightness in the chest due to cold air, irritation when working with the paints, chest pain or discomfort, trouble with smelling odors, and currently we have also seen whether they are currently receiving any kind of medication, and of course majority of them are taking on continuous medication, like one day why he's not well, go to the hospital or medical shop and take the medicine. They're not in a continuous treatment, they're not taking a serious treatment from any doctor. The serious line of treatment is also not being followed by many of them. When we speak about the lung problems with days of working, it was also observed here also, significant impact, more lung problems were seen to be prone among the people who are working for all 7 days in all the cases. And the differences were very significant. We see the amount of work duration per day of the respondents in association with the lung problems. We can see that the people who are working for 7 to 9 years, the people who are working for 5 to 7 hours have less problems, whereas in comparison to people who were working for 7 to 9 hours and more than 9 hours, almost equal impact is being seen for the people who are working for more than 7 hours. And we have seen what kind of safety gear they were using and how it is associated with the lung problems. The people who never use any of the safety gear like mask or they don't use the gloves and all. So usually what the traditional conventional painters do is they take a cloth and they tie it around their nose and mouth if they want to. That is the only safety gear which they use. They don't use any specialized safety gear, especially the painting workers, due to which they inhale all kind of paint dust and all, and due to which they're directly inhaling into their lungs all the chemical components or chemical components existing in the paints. So you can see that the people who, though mask is protecting, we cannot say that mask is completely protecting them, because the kind of mask which they're using is very conventional. But still, you can see the difference among the people who never uses and who uses. There is at least some kind of protection among the people who uses and who never uses the safety gear. So when we see the only mask, mask also, most of the people, you can see here the difference. Though they're using mask, it is not the mask which they have to use, which can stop or protect them from the finer dust. They are using a normal cloth, cotton cloth maybe. So due to which they are not getting 100% protection from the dust or particle dust which they are inhaling. So you can see the contradictory results over here. Though they're using the mask always, still they have the problems related to almost their insignificant differences can be seen, because the mask which they're using is not protecting them from all the particle dust which they are inhaling. So when we have seen the relationship, of course, the working experiences and days of work has positive correlation, and age has positive correlation with the kind of problems which they have. So the kind of problems when we see they're suffering from 28% are suffering from bronchitis, and 62% didn't get themselves tested, so they don't know. 40% are suffering from asthma, and almost 17.3% didn't get it tested. The pulmonary disorders, 35.3% are suffering because they got tested, and 54% don't know because they have not got it tested. Pulmonary edema, 35.3% are suffering from it, and 58.7% didn't get tested. Pneumoconiasis, 34.7% are suffering from it, and 53.3% didn't get it tested. And of course, 70% about the lung cancer, we cannot say these 70% do have lung cancer. No, it is this 8% have lung cancer. It is only that they don't know whether they have it or not. They have a doubt. So 22% didn't get it tested. 8% are in the preliminary phase of getting tested. And of course, for 41.3% have heart disease, and 9.3% didn't get tested anytime. So overall, when we see the link between the painting workers and the respiratory health problems, so the longer duration leading to more breathlessness, cough, tightness in the chest, irritation, and it was also proved by one more kind of study done by Scientex in 2011. And then it also has significantly told that though wearing the mask is significantly associated with respiratory problems, but the mask which they are wearing is not protecting them completely from the finer chemical components of the paints. So we have tried to explore the risks and problems of paints among the painters, especially the breathing problems, the respiratory health ailments. So, and it was found that they've been exposed to many kinds of carcinogens which are responsible for the health problems. And since they are not using, one more thing which we have done over here is across the exclusive criteria, we have not taken a sample who are smoking or tobacco chewing. So we have taken only the sample who do not have habit of smoking or tobacco chewing. So we have also ruled it out. And the majority of the workers are having respiratory health ailments or other health risks, which is associated with dust and other chemical pollutants and solvents. So though wearing a mask and other safety gear is significantly associated with health problems, it was found that since workers are not using it properly or using proper safety gear, hence they are not getting complete protection which they have to get after wearing this safety gear. So, so the population at risk of ill effects of paint exposure. So there is presence and association between the painting and asthmatic symptoms, bronchitic symptoms, and lung issues. And since they are using it for minimum, it can be concluded that the lack of protection increase exposure time. It also increase the contracting disease symptoms associated with this painting. These were the various references used. Thank you.